have said to yourself, I wish I could get up from the floor, but my arthritic knees won't make it possible. Or I wish I could go up and down the stairs like I used to. I wish I could walk a certain distance, but my arthritis keeps holding me back. In this video, we're going to talk about how to make those adventures, those activities possible again, because yes, it can be done. If we haven't met before, my name's Alyssa. I'm a doctor of physical therapy, and I specialize in helping people specifically with osteoarthritis. And after seeing hundreds of people that have bone-on-bone arthritis to people that have very mild stages of arthritis and everyone in between, there are 3 vital steps to getting started and making activities or adventures, as I like to call them, possible. Now, I want you to think about for a second, what is one activity or adventure that you would like to be possible again? Whether it's walking a certain distance, it's going on a trip, being able to get up from the floor, being able to put your socks and shoes on. Just think about it for a second and have it in your mind throughout this video, because that's what's going to push you forward. That's going to be your goal that we are going to work together in order to get there. Just because you have osteoarthritis doesn't mean you have to live years and years and years and years and years in pain. You can get out of pain, you can plateau your symptoms, it is possible. But we have to go at it strategically. So let's go right into step number 1. This, I think, is arguably one of the most important things when it comes to finding arthritis pain relief. One of the things a lot of people miss out on, and this could be because of something that you were told. This could be just as humans, we tend to do this a lot, and you're in pain. But this one thing is actually variety. And if you've been following me on any platform, whether it's Instagram, here on YouTube, TikTok, you probably have heard me talk about this before, but repetition is key. And if you haven't, I'm really glad you're sitting here watching this video right now, because this can seriously change your life. If you think about an average day, how often are you moving sideways or backwards? And really just think about it for a second. Say you're walking out to the mailbox, you're walking to the kitchen, maybe you're going on a walk for exercise. Think about the direction that you're moving in. Odds are you are moving forwards, which is kind of like, oh yeah, I really only do move forwards. And the thing of it is you have muscles that control both sideways movement and backwards movement. Now, these muscles are incredibly important if you have back pain or back arthritis, you have knee arthritis, you have hip arthritis, even ankle arthritis. Moving sideways and backwards is one of the most powerful things, because one, you're working those muscles that tend to get neglected a lot. When you're walking forward, you're using the same muscles, stressing the same parts of the joints over and over and over again. But if we can introduce some variety, we can take some stress off those parts of the joint, those muscles, and start using others. Your joints need support from all sides. So if you take the knee, for example, if we're just primarily walking forwards, or even you could argue cycling, you're still moving in a forwards direction, a lot of times you're working the fronts of your legs. But what about the backs of your legs? What about the sides of your legs? Your knee needs support in those directions as well. So a lot of times also when walking forwards is painful, you may be really surprised at how walking backwards feels. Now, of course, it's going to feel weird at first. It may be a little challenging on your balance at first. But I have so many people who say, you know what, I can only walk a certain distance, very short distance, when I'm walking forwards because it hurts. But when I try backwards, it actually feels really good, because pain is a way that your body's communicating with you. And if you have pain when you're walking forwards, your body's saying, hey, maybe we need to change something. We need to add in some variety. We need to move in different ways. Now, this moving in different ways can look a lot of different ways. So sometimes it's seriously just as simple as stepping sideways. I have a lot of people who do this at the kitchen sink, or do this when they're waiting for something to cook in the microwave or on the stove, when they're brushing their teeth. Looking at backwards, you can do essentially kind of the same thing. You can step forwards and backwards, or you can alternate. Take one foot back, the other foot back, one foot back, the other foot back. It's all about meeting your body where it's at. You can absolutely use support, use the kitchen counter if putting all of your weight on one side is difficult. You can progress by walking backwards down a hallway or walking sideways down a hallway. There are lots of different ways that you can make this easier or harder depending on where you're at and where your pain levels are. But I want you to think about every day from now on, did I move sideways and did I move backwards? Even just spending a couple of minutes accumulating throughout the day of moving in these different directions can be really powerful. The second you find something that doesn't hurt. So say, for example, you start stepping sideways and you're like, wow, this actually feels okay. That starts to build confidence. Well, hey, I can sidestep. Maybe I can try to sidestep a little bit longer. Hey, I can walk backwards. Maybe if I start walking backwards more, then I can start relieving my pain walking forwards. So just start thinking about variety. Now, the second one is conscious movement. What I hear from people who are dealing with arthritis pain, when they tend to decrease their physical activity throughout the day, a lot of times when you ask someone about their movement, how much they're moving throughout the day, how much activity they're getting, I hear a lot, well, I typically spend, time walking around my house. I get up and down from the chair, to go to the bathroom or, whatever it is. But the problem is, this movement that you're just typically doing throughout the day, your body is used to that movement. So, for example, if one of my goals is to be able to walk around the block, before, maybe it took me 10 minutes. So my goal is to walk about 10 minutes. Right now, I can probably walk for about 2 or 3 minutes before I start to experience pain and need to sit down. When you think about the activity that you're doing in order to be able to reach that goal, your body is used to moving around your house and doing the things that you do daily. That's getting up and going to the kitchen, walking to the bedroom. That's your baseline level. Like, your body is used to that. In order to reach a goal or to reach an adventure, especially something that's active and more active than you are right now, you have to incorporate conscious movement. You have to incorporate purposeful movement. Yes, moving around your house, that can help negate some stiffness, that can help keep the blood flowing, but you have to do something above your baseline if you want something to change, if you want your activity tolerance to change. You have to change something to make that goal possible. You just have to do something that's above your baseline. So, for example, if we take what we just talked about the variety, in order to be able to walk longer distances, we have to reduce irritation. We have to reduce pain. So, adding in 30 seconds of sideways movement 3 times throughout the day. Adding in 30 seconds of backwards movement 3 times throughout the day. Combined, that's only a few minutes. But that's above your baseline level. Honestly, after working with people for a few years with osteoarthritis, people trying to get back into movement, people dealing with a lot of pain, the most important thing is really figuring out how you can incorporate movement into your day already. There are lots of ways to incorporate movement throughout the day that honestly a lot of people don't think about. For example, if you are going to stand up from a chair and walk over to the kitchen, and you're not in a rush, like you don't have to rush to the bathroom or anything, instead of just standing up once, you can stand up 3 times, or you can stand up 5 times, and then go do whatever it is you need to do. That's adding purposeful movement. So goal number 1 was to think about moving sideways and moving backwards. How are you incorporating that throughout your day? Secondly, it's how are you incorporating purposeful movement? How are you going above that baseline level? Okay, now, number 3 is actually believing pain relief is possible. Research is showing that the brain plays a pivotal role in how sensitive you are to pain. This is by no means saying your pain isn't real, your pain is in your head. If somebody tells you that, you have to go find a second opinion. This is saying what you think about your pain. If you think there's no way I can find pain relief besides getting surgery, which a lot of people with bone-on-bone pain are led to believe. I've done the damage of my cartilage. My joint has so much wear and tear from what I've done when I was younger or the job that I had, that there's no hope for fixing it other than getting surgery. Or I'm 60, I'm 70, this is just normal. I just have to deal with this. Those thoughts replaying in your mind can do a couple of different things. One, it can make you feel really discouraged. It can make you feel frustrated. It can make you feel sad. It can make you feel depressed. Then you start to limit movement. Then you start to limit your social circle or your social support. You start to limit the amount of times you're leaving the house. You start to limit even the people that you're seeing. Odds are we all want to be independent. We all want to have the choice to do what we want to. And it is possible with osteoarthritis. Now, what's interesting is research also has come to find out that osteoarthritis is more than just wear and tear. You may not be given all of the information, because the good thing about osteoarthritis being controlled by inflammation is there are a lot of factors that contribute to inflammation. So, hence, there are ways that you can reduce inflammation, reduce pain sensitivity, and reduce pain. But if you're not told that and you're told, hey, you have wear and tear, it shifts in your mind to say, wow, there's really nothing I can do about it. When in reality, there is something you can do about it. And I think it's stemming back to the confidence that we talked about before. If you find out more about osteoarthritis, more about what's causing your pain, you start to build more confidence. Well, hey, if my pain is from inflammation and the sources, like if you think about the types of foods that you eat, if you think about maybe the type of stress that you've been under recently, maybe you think about the activity you've been doing, whether it's a lot or not enough. You think about the type of sleep you've been getting. All of these factors play into inflammation. So if we think about, okay, maybe I can improve the types of foods that I'm eating. And you start to make just a couple of changes. Then you start to experience a little pain relief. You start to experience, hey, I woke up and I didn't feel as stiff as I usually do. Or, I really overdid it, but it didn't take me as long to recover as it usually does. These small wins start to compound. Hey, maybe pain relief is possible for me. And in my signature program, we talk about understanding arthritis, figuring out how to prioritize your pain relief, and figuring out how to actually make it consistent. The most powerful module that a lot of people report back and say that they were actually surprised about is the understanding piece, the learning more about osteoarthritis, because what that does is build confidence. It makes a shift in your brain to say, instead of, I can never do this again, or I'm never going to be out of pain, all of these negative thoughts, now we shift into, maybe that is possible. It's not all butterflies and rainbows, but it's seeing that little glimmer of hope that, hey, maybe I can do this. And that is really powerful. And odds are you haven't really received that line of thinking before, because a lot of times when you're in a doctor's office or even when you're talking to family and friends, there's there's a lot of negativity around osteoarthritis. Oh, you should slow down. You should be careful. You should avoid this. You can't do that. Your joint is deteriorating. You have the joints of an 80-year-old. All of these negative thoughts really start to accumulate. So the more that you know, the more power that you can have. And the more that you can believe your goal, your adventure that we talked about in the beginning is actually possible. And that's my whole goal here at Keep the Adventure Alive, is to show you what is possible. Because once you start to swing open that door a little bit to see your adventure, to realize what you can actually accomplish, it can truly change your life. It can change the course of how you're thinking about your osteoarthritis, how you're acting about your osteoarthritis, and it can really take you from this downward slide into this upward slide of being able to hike again, being able to enjoy playing with your grandkids, being able to see a city you never thought you would see, be able to go out and not have to worry about how many stairs there are going to be, or if you're going to have to go up a curb or not, or if the sidewalk is going to be even and not uneven. It can be done. Thank you so much for listening to this. I hope this gives you a new perspective on how to think about your osteoarthritis and how you feel about your future. My whole goal is to bring you hope with osteoarthritis. Hope that you can achieve not only pain relief, but you can achieve adventure.